Hello, and welcome to our presentation on neuroblastoma. Your presenters today are Sujata, Sherelle, Lisa, and myself, Maria. Our case study today is on Matthew Brown, an 18-month-old boy from Melbourne who was brought into ED due to unexplained weight loss, fever, weakness, drowsiness, diarrhea, and mild distension of his abdomen. Matthew is usually healthy. Each course of infant vaccinations has been given as charted. He was born full term at 41 weeks gestation, arriving at a very healthy 4.2 kilograms. 5 vaginal delivery after a normal pregnancy. However, mum, Sam, admits to smoking a pack of weed during the pregnancy. Matthew was breastfed for 12 months before his mum weaned him to formula. He has hit each developmental milestone at the appropriate age and comes from a conventional family unit of a biological mother and father, Pete, and he currently has no siblings.
Matthew was sent home from childcare due to being unwell 2 days ago. Sam has been giving Panadol at home for his temperature, but became worried when Matthew became increasingly drowsy over the last 24 hours and has noticed a decrease in his oral intake and an increase in his abdominal distension. Upon palpation, Matthew's abdomen appears to be pain-free, distended, and a small mass can be felt.
Now, as to the pathophysiology of neuroblastoma is the development of malignancy of neural ganglia, which originates from a neural crest-derived cell. Neuroblastoma is a highly heterogeneous disease with multiple biomarkers. Three broad categories for pathophysiology are the MYCN gene amplification. MYCN is an oncogene which causes excessive cell multiplication. Overexpression of MYCN causes a formation of a huge number of MYCN proteins, which speeds up the cell division process and forms a tumour. This is found in the majority of cases.
Chromosomal deletion. Deletion in various locations of chromosomes, such as IP11q, 14q, can lead to failure in stopping abnormal cell division. Due to the deletion of these sections of chromosomes, cells cannot be stopped from dividing abnormally. For example, low expression of molecules such as glycoprotein CD44 or overexpression of telomerase, which ultimately can lead to excessive cell division and cause tumours. Changes in the DNA content. In addition to deletion in chromosomes, as mentioned previously, in some cases where the number of chromosomes are altered can also manifest as a neuroblastoma. However, children with hyperdiploid tumours have a better survival rate compared to diploid tumours.
We have explained the pathophysiology of how tumors are formed in neuroblastoma, but the tumor can be found anywhere in the sympathetic nervous system. Approximately 2/3 of neuroblastoma are found in the abdominal region. Distension of abdomen, as seen in Matthew, can be due to the tumor growth in abdominal region. Abdominal tumors can compress the bowel and cause reduction of food and water intake, as seen in Matthew. Tumor cells can also secrete vasoactive intestinal polypeptide, which can cause secretory diarrhea. This can ultimately lead to weight loss, weakness, and drowsiness.
So what is neuroblastoma? Neuro means nerves and blastoma is a cancer that affects immature or developing cells. Neuroblastomas are cancers that start in the nerve cells called neuroblasts of the sympathetic nervous system. This means that tumours can be found anywhere along this system. Mostly, in about 50% of cases, they start in the adrenal glands, above the kidney, or near the spine, chest, neck, or pelvis.
So the epidemiology, neuroblastoma is a rare disease with about 40 children diagnosed each year in Australia. The likelihood of a child developing neuroblastoma in Australia is 1 in 100,000. No trend towards increasing diagnosis have been noted. 1 in 10 cases is found in neonates. However, most neonates are diagnosed before birth during routine ultrasound. Rarely a neuroblastoma has spread so widely by the time it is found. Doctors can't tell exactly where it started.
Neuroblastomas are the predominant tumour affecting the sympathetic nervous system, comprising of about 97% of cases, and represents the most prevalent form of malignancy during infancy. Typically, like in Matthew's case, it's diagnosed around 17 months. The vast majority of cases are diagnosed before age 5. It contributes to approximately 15% of paediatric cancer-related fatalities.
The traits of the cells and early onset hint at genetic influences and perinatal exposures. Risks associated with neuroblastoma can include a family history of the disease. However, unlike Matthew, these children are likely to have multiple sites and present younger when this is the case. Studies have also noted links between neuroblastoma and congenital malformations, higher birth weights like Matthew's, and maternal smoking during pregnancy.
Now we will discuss the implications of neuroblastoma on childhood development and how we can promote family-centered care. A cancer diagnosis will result in a child becoming immunocompromised, which impacts their ability to interact and develop socially and intellectually. Early childhood is characterized by periods of rapid development with particular milestones reached only months apart. The Early Years Learning Framework and a national quality standards state that children develop physically, emotionally, socially, and intellectually from birth to 5 years of age. Disruptions to the stages of development can impact outcomes as adults, such as mental and physical health, education, and behavior. At 18 months old, children develop gross motor and social skills, such as partaking in parallel play with other children and engaging in more boisterous physical activities, such as walking, running, and climbing.
When a child is diagnosed with cancer, their life changes drastically. For Matthew, frequent hospital visits and recovery from treatments such as chemotherapy or surgery will disrupt time spent with other children, particularly if he is removed from daycare or is unable to attend. Children aged between 18 months and 5 years old were readmitted to hospital on average 20 times per year. Furthermore, between the ages of 1 and 2, children begin to develop anxiety when separated from parents or carers, take cues from parents or primary carers regarding their attitude towards strangers, and seek comfort when they are upset or afraid. Being in a hospital setting can be a frightening and overwhelming experience for a child of that age, especially if they require diagnostic tests and/or surgery.
Implementing structured play during hospital visits and at home encourages development in early childhood. Structured play can be varied from puzzles and toys to making small obstacle courses for Matthew to play in. The hospitals may have a program for the paediatric patients that facilitates children playing together during a hospital stay. Nursing staff can liaise with paediatric physiotherapists to build a program for Matthew that can be utilised in both the hospital and at home. The program will include activities that are mentally and physically stimulating. The nursing team can use a collaborative approach with Matthew and his parents to ascertain what activities he enjoyed partaking in at childcare. Making an effort with Matthew to make his hospital stays engaging and fun may ease feelings of anxiety or frustration, and in turn ease his parents' anxiety.
Another development issue is the long term effects of chemotherapy. Survivors of childhood cancer are at risk of developing chronic conditions as they age. Chemotherapy and radiation can lead to issues with the cardiovascular, pulmonary, auditory, gastrointestinal, renal, and neurological symptoms. Treatment for these conditions may require hospital admissions, which further disrupts a child's routine and life.
Platinum-based chemotherapy medications such as cisplatin and carboplatin are commonly used to treat neuroblastoma. However, they are associated with many undesirable side effects such as alopecia, diminished appetite, nausea, vomiting, kidney failure, and hearing loss. Hearing loss is one of the most commonly reported side effects of cisplatin, with up to 82% of children diagnosed with neuroblastoma having moderate to severe hearing loss. Children who experience cisplatin-induced hearing loss may experience difficulties in developing speech and language, impacting them academically and socially.
Hearing loss in children can increase levels of anxiety within the family if they do not receive adequate information and support to cope and adapt. Language barriers children face can be traumatizing, particularly if they're unable to communicate with their family members. These barriers increase the risk of emotional and physical neglect, sexual trauma, and higher rates of depression and anxiety. Furthermore, health system barriers, including poor access to primary care and understanding medical terminology, increase with poor language development.
Promoting family-centered care for Matthew requires effective communication and collaboration between the multidisciplinary team and Matthew's family. Nurses can educate Matthew's parents regarding the side effects of chemotherapy and potential ongoing treatment. In particular, resources on managing hearing loss can be provided, including information on required diagnostic tests, such as autoacoustic emissions, auditory brainstem response, tympanometry, and behavioral audiometry. Making decisions for their child's treatment may leave parents feeling overwhelmed and emotional. Providing Matthew's parents with a safe space to ask questions or voice anxieties they may be feeling as they process the information will make them feel supported and empowered in their decision making.
Let's talk about psychosocial impacts. Young kids with neuroblastoma face not only physical challenge but also psychological issues which can significantly impact their well-being. Single room isolation due to radioactive treatment, limited contact with caregivers, emotional stress, and pain due to other treatment procedures such as central line can severely impact psychological well being of an oncology patient. In addition, for the optimal psychological, emotional, and cognitive development, infants and toddlers need consistency, warmth, predictability, security, and opportunities to explore within the environment. However, due to our inability to provide such an optimal environment for Matthew, he may face significant impairment in his cognitive and adaptive development.
Furthermore, financial disadvantages faced by parents of chronically ill patients can also be a source of psychological stress for the family. Inability of the caregiving parent to return to work, anxiety, mood disorders, mental exhaustion, and fatigue while looking after a very sick child can also affect the psychological well-being of Matthew and his family.
And with family centred care, Matthew may experience a range of psychological issues, including anxiety and fear. He can present with changing behaviours, difficulty coping with medical procedures, and sleep disturbances whilst going through the treatment. As a nurse, we can use evidence based intervention to Matthew's developmental stage and individual needs, such as art therapy, which promotes emotional healing and self expression. Matthew can benefit from art therapy interventions such as drawing or painting, as it offers non-verbal outlets for communication and helps toddlers process their emotions in a safe and supportive environment.
Music therapy can help Matthew in utilizing music based intervention to convey physical, emotional, and cognitive needs. Kids with neuroblastoma may find comfort and relaxation through music therapy, such as singing or listening to music. Music therapy can help in soothing Matthew's anxiety and improving his mood. Play therapy. Play therapy can also be used as another therapeutic approach for Matthew, as toddlers can express their emotions, develop coping strategies, and regain sense of control in their environment through play therapy. We can facilitate playgroup sessions and provide Matthew with age-appropriate toys and activities to involve him in the therapeutic play.
As mentioned earlier, we have spoken about how financial disadvantages can cause a psychological effect in Matthew's parents. Listening to the family about the concerns and referring family to the social worker might help in finding appropriate government financial assistance and reduce at least the financial burden of the family. In addition, trying to connect Matthew and family with various peer support groups will be beneficial for the family. Peer support groups can help us recognize our strength, share their experience, and educate each other on how to overcome challenges.
Let's talk nursing interventions. Intervention would be caring for the immunocompromised. Matthew is immunocompromised. His body's ability to fight off infection and disease has been weakened, and this affects every facet of his life for the duration of chemo and beyond. From a nursing perspective, it is vital that we implement strict infection control adherence and provide detailed education to his parents to minimize the risk of him developing a potentially life-threatening infection.
So within hospital measures, we'll be doing hand hygiene. So pathogens are spread by healthcare workers' hands, and it's a leading cause of infection in an acute setting. Infection spreads through what is known as the chain of transmission. It is generally accepted that pathogens require an infectious agent, a mode of transmission, a portal of entry, and a susceptible host. Washing hands with soap and water or alcohol-based hand rub breaks the chain of transmission by removing the harmful agents from the hands and minimising the risk of that pathogen reaching Matthew.
Isolation and transmission-based precautions. It's vital that Matthew is kept in a controlled environment that minimises the contact he has with external pathogens and prevents his body fluids from coming into contact with others. Hospital-acquired infection is one of the biggest risks whilst being an inpatient. Correct PPE use ensures that the risk of infectious agents being passed from the healthcare worker to Matthew is mitigated. His bodily fluids contain the chemotherapy agent for up to a week post-administration, which poses a risk to healthcare workers and anyone who may come into contact with them.
Central lines. Matthew will have either a Hickman's catheter or port inserted, as chemotherapy agents are very damaging to the small peripheral veins. Central line associated bloodstream infection are one of the potential risks of having such devices in situ. Strict non-touch aseptic technique and adequate cleaning with accessing these devices is crucial, as these devices are inserted into a large central vein. Any pathogen that makes its way into the catheter is injected directly into systematic circulation, which can have severe consequences. They must be aspirated and flushed regularly to prevent thrombus formation, and dressing must be changed using sterile technique. Central lines are to be closely monitored for signs of infection such as redness or swelling at the incision site, with any concern escalated immediately. They must also be measured regularly to monitor any signs of dislodgement, and the dressing should remain in.
Skin assessments. Skin lesions are a common side effect of chemotherapy. This breakdown in the integrity of the skin provides a portal for entry for infectious agents to enter the body. As Matthew has a weakened immune system, his body is not easily able to fight off even the most benign of viral or bacterial infections. Matthew's poor nutritional state will impede wound healing, giving pathogens another portal of entry, so it is important that any surgical wounds are adequately managed and that lesions or rashes are identified early and treatments such as dressings or creams are applied.
While at home. So, whilst pets are an incredible source of emotional support during this stressful time, household pets can expose Matthew to a variety of infectious sources. It is important that Matthew and his family understand that he must remember to wash his hand after cuddles with his pets and avoid allowing the pet to lick his face. Care must be taken to ensure he avoids coming into contact with any of the urine or feces of his furry companion. He should avoid any contact with livestock, farm animals, birds, or wild animals. It is important to keep the family pet up to date with worming, flea treatment, and vaccination to limit the risk of zoonotic transmission.
Sick contacts. Education should be provided around avoiding people who are unwell, as this increases Matthew's chance of becoming infected. Immunizations. It is vital that the family and those that will come into contact with Matthew in hospital and at home are up to date with their vaccinations, as this will minimize the likelihood of transmission of disease.
Now, oral hygiene. Mucosal lesions can form as a result of treatment. These lesions have the potential to bleed or become infected, so strict oral hygiene is important. Education in hospital around maintaining oral hygiene must be provided, and encouragement for Matthew and his family to monitor for any signs of mouth ulcers and report these to the treating team. Management may include saltwater rinses and ice cubes prior to chemotherapy administration.
Another intervention is to provide family centred care and to refer to social workers for external supports for both Matthew and his family to reduce their anxiety. Given that cancer can be a very scary diagnosis with all of its unknowns, Matthew and his family will be feeling anxious. 18-month-old children look to their parents for social cues on how to process situations unfamiliar to them. As nurses, we need to build a therapeutic relationship and provide family centred care in order to reduce anxiety in the family unit. Matthew may experience some frequent and possible extended stays within the hospital to help fight his neuroblastoma with treatments like biopsies, resections, immunotherapy, radiotherapy, and chemotherapy, causing financial, emotional, and mental strain on his young family. Most families within a hospital will be referred to a social worker to provide support during and after treatments. Social workers can refer to many different external organisations that would be appropriate for Matthew and his family.
These supports can include and are not limited to those that can provide financial support and advice, have support dedicated to enhancing information knowledge about treatment and living with cancer, and support groups for both the children and their families.
Red Kite is one of the main supports offered. It is a national organisation dedicated to offering emotional support, financial aid, and access to information and resources for families requiring support after a diagnosis of childhood cancer, and is often a well utilised resource in Australia. Red Kite gives a red bag for newly diagnosed children, usually provided by the hospital social worker, so most families are aware of the incredible support they can provide. Canteen provides a parental support program called Parent Connect. Parent Connect is an online platform that offers information, peer support for parents navigating a diagnosis of cancer in their young person, and of course resources. Online counselling services are easily accessible throughout the week, including evenings.
Family-centered care is a caregiving approach tailored to children and their families. It prioritises teamwork between the healthcare providers and families for the child's emotional, social, developmental, and physical requirements. It encompasses 4 primary principles: respect and dignity, transparent information exchange, active involvement in care and decision making, and fostering collaboration between patients, families, and the healthcare professionals. Research indicates that having family members present can positively impact the patient and their family, which can lead to better health outcomes for the patient.
As nurses, we can refer to the social workers to help provide holistic, family centred care to both Matthew and his family. We can evaluate how successful our care has been by asking Sam to teach back the information that she has retained about Matthew at an appropriate time. Both Sam and her husband Pete are coming to terms with their son's diagnosis and digesting all that information. Providing a safe space for questions and reflection can alleviate some stress and anxiety and provide clarification of any information given.
So, to summarize, this case study followed the story of Matthew, an 18-month-old who presented to the ED with unexplained gastrointestinal issues and distension of his abdomen. A diagnosis of neuroblastoma was made. Neuroblastoma is a rare form of cancer affecting approximately 40 children a year.
It begins in the neuroblasts along the sympathetic nervous system, with the most common site in the adrenal glands, followed by the abdomen.
Frequent hospital visits and immunosuppression can hinder a child's development. Chemotherapy can impact a child's health into adulthood, including permanent hearing loss. A diagnosis can disrupt the family unit and create high levels of anxiety and stress. Nursing interventions include adhering to strict infection control, education, and providing family centered care to reduce anxiety during treatment.